then 98%, so it can come back by 12, it can like start by 12 weeks also, but most of the times by 98, in like 98% cases it goes around till 6 months. So I think we'll just remember 6 months as the value. So however, ovulation may precede the first menstrual cycle, and it is possible for patient to that's why it is possible for a woman to become pregnant before she menstruates following her confinement. Non-lactating mothers, that's why non-lactating mothers should start using contraceptives by third postpartum week, and lactating mothers by third postpartum month. Then thyroid function, so thyroid also has enlarged during pregnancy, that's why thyroid disorders are increased during pregnancy. So now thyroid is regressing back to its size, and by around 12 weeks it goes back to its normal pre-pregnant state. Now next, talking about lactation. So lactation has two different processes. Lactation is basically feeding the baby, production of milk and feeding the baby. We have two things here. We have milk production, that is galactopoiesis, and we have milk ejection, which is galactokinesis. So what is the physiology of lactation? So although lactation is starting immediately after delivery, this preparation begins early in pregnancy. So in breast changes as the maternal adaptation to pregnancy, there in breast changes by 12 weeks itself, gland starts secreting colostrum. Like, I won't call it colostrum, but discharge from the breast is seen as early as 12 weeks, but it is not very significant to the mother or baby at that time. It's just a sign, short sign of pregnancy. So what is the main mechanism here? So first part is preparation of for lactation to occur. We need these four major steps. First we have mammogenesis. In mammogenesis there is development of breast. So we say during pregnancy there is increase in the fat and the subcutaneous tissue of breast. That is mainly because of insulin. Then there is increase in the ducts. That is because of estrogen, and there is decrease in alveoli because of estrogen and progesterone both. Then the nipple becomes more erect and prominent. There is presence of areola, which are modified sebaceous glands, then tubercles of Montgomery, secondary tubercles. All these changes are completed by T2, and these changes are more prominent obviously in primigravidas when compared to secondary like multigravida. So this is mammogenesis. Next comes lactogenesis, which is nothing but production of breast or milk. Then third is ejection, galactokinesis, and fourth is maintenance. So what is lactogenesis? Here the alveolar cells are principal sites for production of milk. Though some secretory activity is evident from, again, that's what early pregnancy, milk secretion, actually proper milk secretion begins from third or fourth day. So initial first 2 days you have colostrum, which is rich in fats and immunoglobulins. Then steroids and okay. And by this, so I said this very important point that milk secretion is beginning as early as 12 weeks. But why is there very little breast milk? That is because during pregnancy there is high level of estrogen, and this estrogen is inhibiting prolactin. So it is keeping prolactin in check, and that's why the discharge is very bare minimal. Same thing after pregnancy, estrogen is lost, prolactin becomes high, and you have proper milk production. So that's the main cycle here. So prolactin, insulin, and glucocorticoids are important hormones in this stage. And for milk secretion to occur, nursing effect is not essential. So this is milk production, about how it and what enzymes act. What hormones act. So the alveolar cells are the principal site of production of milk. Now coming to galactokinesis. So oxytocin is a major galactokinetic hormone, and this is responsible for discharge of milk, so sucking reflex. So what happens now? Look at this very beautiful chart. When there is sucking, when the baby tries to suck milk, stimulus goes to the pituitary. So from the thoracic nerves, spinal nerves, stimulus is going to the pituitary, hypothalamus. So this is sending signal, and this is sending signal and releasing oxytocin. Oxytocin goes to the it basically goes to the myoepithelial cells, leads to contraction of myoepithelial cells, and then there is let down of milk, release of milk. So this is a conditioned reflex. As in long the baby sucks, there will be production of oxytocin. This oxytocin also acts on the GI and increases GI motility, also acts on the uterus and helps in puerperial uterine involution. So breastfeeding is very, very important. And oxytocin is produced by paraventricular and supraoptic nuclei of hypothalamus. So it is synthesized in the hypothalamus, then it goes to the pituitary, posterior pituitary, and then it is released via blood. Efferent is through blood. This is the milk ejection or milk letdown reflex. Not just sucking, but babies cry, baby touching the mother's nipple or just close to the nipple can also stimulate milk production. Milk ejection is a reflex is inhibited by pain, anxiety, and breast engorgement, depression. Then next, the last component is galactopoiesis. So galactopoiesis is prolactin is one of the most important galactopoietic hormones. So for maintenance of effective and continuous lactation, frequent sucking is essential. So ductal and alveolar distension due to failure of milk transfer can lead to lactation failure. So prolactin is very important. Nighttime sucking is very important to maintain milk production. And next, milk, around 500 to 800 ml milk is produced. It's about that is around 700 kilocalories per day of, that is why 700 kilocalories per day of diet is required by the mother. Now lactation suppression. So in lactation suppression we want to block production of milk. So why would we want to do that? For any personal or medical reasons, for example, when breast milk is contraindicated, like when the woman is taking chemotherapeutic agents, or she has active herpes simplex virus infection, or there is intrauterine fetal demise, neonatal death. So in these cases we want to suppress. So we can go for different methods here, and these methods. So what we can use different set of methods. So if we stop breastfeeding, then because suckling is not there, oxytocin milk letdown won't be there, and because of the same reason, night feeding not there, prolactin reduces. So this is one method. So stop breastfeeding, stop pumping, then where is support, ice the engorgement area, analgesics can be given to relieve pain. Medical methods are give estrogen, androgen, bromocriptine, usually not advised because of side effects like hypotension, rebound secretion, seizures, infarction and all.